Hi. We are Diabetes Consciousness. We are here to help you find solutions towards health. We understand how important it is to know as soon as possible what is happening to your health or your loved ones, so if you are looking for help in detecting diabetes early, be sure our team is here to help you. In this video, you will learn how to spot early signs of diabetes. Today we will tell you about 10 early warning signs. We'll cover one by one as well some important facts related to the early diabetes diagnosis in any person of any age. First of all, we must put one straight that the only way to diagnose diabetes in all cases is through laboratory tests in blood and urine. Consequently, if the results show alterations and the diagnosis is confirmed, the patient must be aware that this health condition could have been present some time ago. Therefore, the knowledge of early warning signs is the first and most essential tool for prompt detection of patients with diabetes type 1 or type 2. Here are the 10 most frequent early signs to suspect diabetes. 1. Weight outside the normal range in newborn children. Weights above or below established ranges as the standard for the population to which the newborns belong. Unfortunately, these infants have a 22% to 28% chance of having insulin disturbance as a cause of their altered weight and may then develop diabetes. 2. Decreased cranial diameter in newborn boys. These newborns can show an alteration of the specialized cells of the pancreas, called beta cells. Later in life, they manifest insulin resistance as an expression of this dysfunction. 3. Difficulty in weight control with a tendency to obesity in childhood. Every year, more children suffer from obesity due to poor nutrition, specifically in North America. However, most pediatric patients with excessive weight gain respond satisfactorily and sustainably to intervention. The patient who does not respond is usually a patient who has insulin disturbance, even before elevated blood glucose levels. 4. Metabolic syndrome. Metabolic syndrome is a cluster of conditions that occur together, increasing the risk of heart disease, stroke, and type 2 diabetes. In the pre-adolescent stage, the triad of obesity, hypertension, and unhealthy lipid levels, known as dyslipidemia, can present a 3.05% chance of being a diabetic patient in addition to blood microalbuminuria. Microalbuminuria is a sign of kidney disease and means too much albumin in the urine. Albumin is a protein found in the blood. A healthy kidney doesn't let albumin pass from the blood into the urine. 5. Childhood obesity itself. For some years previously, it was considered a resulting disease to diabetes. Nowadays is more characterized as an early sign of diabetic patients. Before going further with the next following warning signs to know how to spot early signs of diabetes, we invite you to subscribe to our channel and give us your like to this video. Our team is always carefully creating valuable content that can make you feel seen and included as part of our community. We are always happy to hear if you like our content, and we appreciate your response. Also, remember to visit our other videos. We talk about topics that can be interesting to you and learn more about this health condition. Let's continue. 6. Polycystic ovary syndrome. It is the most frequent hormonal disorder in women of reproductive age, and so, between 31% and 35% of women who present it have diabetes as well. These patients may have serum glucose levels within normal limits, but a detailed analysis may demonstrate metabolic alterations that confirm the diagnosis of diabetes type 2. In addition, polycystic ovary syndrome is frequently associated with a third type of diabetes called gestational diabetes. 7. Acanthosis nigricans. It consists of hyperpigmented spots that follow the course of the most important body folds, such as the nape of the neck, neck folds, armpits, inguinal region, and inner thighs. 90% of young diabetic patients present this kind of spots. Acanthosis nigricans is a frequent reason for consultation for aesthetic reasons but rarely investigated as a symptom of diabetes. 8. Subclinical metabolic alterations, which are usually detected by serology, blood tests such as transient elevation of blood glucose, and increase of glycosylated hemoglobin. 9. Excessive urination. Clinically known as polyuria, it consists of frequent and abundant urination. It can be detected before severe organic damage happens given by the complications of diabetes in the body. 10. Profuse thirst. It is a permanent thirst sensation without an obvious cause, such as exposure to heat, prolonged fasting, or moderate and intensive exercise. As a matter of fact, if we consider that approximately 1/3 of children and adolescents who have diabetes are asymptomatic, this conducts us to search for these signs in at-risk populations actively. In the American Diabetes Association Consensus on Diabetes Type 2 in Children and Adolescents, it was recommended that those with 2 or more risk factors, such as first and second degree family history of diabetes, at-risk race or ethnicity background, signs of insulin resistance, or conditions associated with insulin resistance, should be screened every 2 years, particularly starting at the age of 10 or the onset of puberty. The test should include fasting blood glucose, 2 hours after an oral glucose overload, and random blood glucose lab tests. As it happens, during puberty, there is a period of insulin resistance produced by the hormonal change of age. Therefore, an adolescent with a predisposition to type 2 diabetes can manifest the disease. Medicine has reported cases of type 2 diabetes in children under 10 years of age, so studying the high-risk factors for this age group is recommended. This evaluation should include other factors such as blood pressure, obesity, adipose tissue distribution, family history of first-degree diabetes, socioeconomic status, presence of acanthosis nigricans, and polycystic ovary syndrome. If you want to know more about this topic, we invite you to watch our videos on our YouTube channel. One of them is a type 2 diabetes definition video from where you can learn more in depth about it. We hope this information helps you find a solution path in your life. Please support us. Subscribe to our channel and activate the bell button to receive notifications every time we upload new videos. If you want to know about a specific topic, or have any questions, leave us your comment below. Also, if this information is helpful to you, share it and don't forget to give us a nice like. You're the reason why we're here. Thank you.